Hello everyone, welcome to SCALP Acupuncture Part 15, presented by Lamp AcuWellness Foundation Inc. as part of its continuing Lamp Lecture Series. We will talk about techniques, acupuncture needle therapy, and electroacupuncture therapy on this episode. Needles should be 1 to 1.5 sun in length, 30 to 34 gauge filiform needles for most conditions. For a child, use 0.5 sun needles to insert. For people with weakness conditions, use a 1 sun needle. There are two important steps for needle insertion: the initial insertion and then pushing the needle further into the scalp tissue. Rapid insertion. Use the thumb and index finger of one hand to hold the needle with a cotton ball 0.5 centimeter from the needle tip, or insert the needle aided by the thumb of the pressing hand. Follow the stimulation area direction. Hold the needle and quickly insert it into the skin to the subaponeurotic tissue with a 15 to 30 degree angle of insertion. Rapidly pushing the needle in. After the needle has been inserted into the scalp or the subaponeurotic tissue, follow the stimulation area, quickly pushing the needle in to the appropriate depth. When pushing in the needle, two methods may be employed. One hand. After the needle has been inserted into the subaponeurotic tissue, use the thumb and index finger of one hand to hold the lower part of the needle handle and push the needle in the direction of the stimulation area. Two hands. Use the thumb and index finger of one hand to hold the lower part of the needle handle and use the thumb and index finger of the other hand to gently hold the scalp around the area where the needle was inserted to prevent bending the needle upon insertion and to relieve pain. Hold the needle and quickly push it into the appropriate depth. If during the needle insertion the patient feels a lot of pain, that indicates the needle came in contact with hair follicles, blood vessels, or nerves. Proper needle insertion should be painless for the patient and feel smooth to the practitioner. There are 6 techniques for manipulation. Technique of twirling and rotating the needle. This technique consists of twisting the needle but not thrusting and lifting it. The needle can be rotated up to 200 times per minute for 2 to 3 minutes. During rotation, hold your shoulder, elbow, wrist, and thumb stable and in a relaxed position. Bend your index finger and grasp the needle with the distal interphalangeal joint of the index finger and the thumb. Quickly twist the needle in a forward and backward direction. With manipulation, the patient will usually experience a chi sensation, which may last for only 5 to 10 minutes. After this time, the manipulation will need to be repeated 3 to 4 times to complete a treatment. Technique of thrusting and lifting. Use your left hand to hold the area you want to stimulate and your right hand to hold the needle. Hold the needle with the thumb and index finger with the needle at a 15 to 30 degree angle to the scalp for the following techniques. Number 1. False lifting. With this technique, you will tug on the needle as if to pull it outward, but the tension of the scalp will prevent the needle from moving more than 1 fen, 0.1 sun. Repeat several times until a tight sensation is felt under your fingers. Number 2. False thrusting. With this technique, you gently push the needle as if to thrust it in further. But the resistance of the scalp prevents the needle from moving forward more than 1 fen, 0.1 tsun. Repeat this technique until a tight sensation is felt under your fingers. After attaining the chi sensation, manipulate the needles for 3 to 5 minutes and retain needles for 24 to 48 hours if necessary. Technique of reinforcing and reducing with direction of needle tip. To reinforce, the needle should be inserted in the direction of the line or meridian as in the macroacupuncture system. To sedate, insert the needle against the direction of the line or meridian. For example, for the frontal midline, remember that the due meridian flows from the spine to the vertex and ends at the nose. To tonify, insert the needle at 224, sen, ting, pushing the needle down to the forehead following the meridian direction. To sedate, insert from the anterior hairline, pushing the needle up to the vertex against the meridian. For the vertex midline, the line meets the due meridian at the vertex area, and the due meridian flows from the spine to the vertex and ends at the nose. To tonify, insert the needle from 220 pai hoi forward to 221 qian ding, pushing the needle along the meridian. To sedate, insert the needle from 221 qian ding backward to 220 pai hui, pushing the needle against the direction of the meridian. This technique can also be used on ISNSA and true scalp acupuncture systems. It is important to decide which direction along the meridian to direct the needle. Technique of reinforcing and reducing with slow or rapid insertion. This method is adopted from the macroacupuncture technique that uses slow or rapid insertion with heavy or gentle manipulation and withdrawal. Number 1, tonification. Slowly but forcefully insert the needle into the subaponeurotic tissue with heavy pressure on the scalp point. Divide the therapeutic area into 3 portions. Use heavy pressure and gentle lifting technique on the first portion until chi arrives. Then, push the needle into the second and third portions using the same manipulation as in the first step. Withdraw the needle quickly and close the hole with a cotton ball. This technique can be repeated several times. Number 2, sedation. Divide the therapeutic area into 3 portions. Quickly insert the needle to the last depth of the subaponeurotic tissue and then slowly and forcefully lift the needle up so that the needle point area on the scalp will visibly become a small bump due to the needle lifting up. Lift the needle to the second and first portion and manipulate the same way. The technique can be repeated several times before the needle is withdrawn completely. For the sedation technique, the needle should be withdrawn with the needle hole left open. Technique of vibration. For this technique, insert the needle into the scalp and push the needle into the subaponeurotic tissue to 1 tsun deep. Manipulate the needle to elicit chi and retain for 1 minute. Then, lift the needle up 1/3 and use gentle rotation with lifting and thrusting. Manipulate the needle with vibration 9 times. Manipulate the needles every 3 to 5 minutes. Techniques of comprehensive tonification and sedation. This technique is a combination of lifting and thrusting techniques. Insert the needle slow or fast. Insert the needle with the point against the meridian or follow the meridian. Insert and withdraw the needle with the scalp point hole open or closed. Number 1. Comprehensive tonification. Insert the needle into the scalp and push the needle to subaponeurotic tissue and then divide this layer into 3 distances. Every part will be an average of 4 fen, and every part will use the heavy pressure and gentle lifting technique up to 9 times. This technique can be repeated several times. Then, retain the needle for 30 minutes, withdraw the needle quickly, and close the needle hole. Number 2. Comprehensive sedation. Insert the needle into the scalp from anterior to posterior or superior to inferior direction. Quickly push the needle into subaponeurotic tissue and then divide into 3 portions. Every part will be 0.3 to 0.5 sun and use the heavy lifting and gentle pressure technique 6 times. Then retain the needle for 30 minutes in the last 0.4 sun distance. This technique can be repeated several times. Withdraw the needle and keep the hole open. In addition, during the period when the needle is being retained, you can use 6 auxiliary techniques to increase the meridian energy, such as vibration, shaking, and pressure techniques. Multiple needle insertions require needling the stimulation point or area on the scalp using 2 or more needles. Scalp acupuncture against insertion technique. This is performed with opposite insertion from up to down or anterior to posterior using 2 needles. For example, up and down against insertion. This technique is mostly used on the forehead area. On the frontal midline, insert the needle on Do24, Shen Ting, pushing from up to down, and with another needle inserted from the anterior hairline, push from down to up. The 2 needles are inserted in opposite directions. Line 1 lateral to the forehead, line 2 lateral to the forehead, and line 3 lateral to the forehead can all be used with this technique. Anterior and posterior against insertion. To insert on the midline of the vertex, insert a needle from Do21, Qian Ding, and push backward to Do20, Bai Hui, and insert another needle from Do20, Bai Hui, pushing forward to Do21, Qian Ding. The 2 needles are pushed toward each other. Line 1 lateral to the vertex and line 2 lateral to the vertex can also be used with this technique. The principle of scalp needle against insertion is that the 2 needles are inserted toward each other, but it is not required that the needle tips touch. Y-shaped needle insertion. Use 3 needles to form the shape of a Y. 1 needle is inserted toward Do20 from back to front. 2 additional needles are inserted, 1 sun anterior and 0.5 sun lateral to Do20. Insert toward Do20. The 3 needles will look like the letter Y. The purpose is to increase needle sensation. Across needle insertion means insert 2 needles in 2 different meridians. Across insertion from the midline of the vertex and the anterior oblique line of the vertex temporal. Use 2 needles across insertion. With 1 needle, insert from Do21, pushing backward to Do20. Another needle should be inserted from the point of Xianshan-Kong, pushing along the anterior oblique line of the vertex temporal. These 2 needles will form a cross on the scalp. A cross insertion from the anterior oblique line of the vertex temporal to the posterior oblique line of the vertex temporal. This technique uses 4 needles to work with these 2 lines. Starting at Xianshan-Kong, insert the first needle into Do20. Then, along the anterior oblique line of the vertex temporal, locate the upper 1/3 point on this line. Insert the second needle starting at the upper 1/3 point to the posterior oblique line of the vertex temporal. Then insert the third needle from the midpoint on the anterior oblique line of the vertex temporal, posterior toward the posterior oblique line of the vertex temporal. The last needle will be inserted from the lower 2/3 point on the anterior oblique line of the vertex temporal, posterior toward the posterior oblique line of the vertex temporal. Connecting power insertion. This technique is used on the anterior oblique line of the vertex temporal and the posterior oblique line of the vertex temporal and uses multiple needle insertions. It can also be used on Chiao's scalp acupuncture system. Use 3 same-sized filiform needles and insert from the starting point of the line, such as from Do21, and divide the whole area into 3 equal parts. Insert the needles from the starting point of the first and second 1/3 points and push the needles from up to down to connect with each other for the purpose of connecting power to increase local energy. Needle group insertion is divided into 2 parts: the Qi-Si technique and the Yang-Si technique. Qi-Si technique use 3 needles with close insertion to the same scalp point or treatment line, used for the middle line of the forehead, the middle line of the vertex, and the upper middle line of the occiput. For example, on the middle line of the forehead, insert the needles at Do24, and then insert a second and third needle 0.5 Tsun lateral to Do24 toward the middle line, the 2 meridian. Therefore, the 3 needles are all inserted on the anterior hairline using the running needle technique. For the middle line of the vertex, insert the needle on Do21 and push backward to Do20, and then select 2 more needles and insert them 0.5 Tsun lateral from Do21 and needle toward Do20. For the upper middle line of the occiput, insert the first needle in Do18, Qiangqian, toward Do17. Now Hu. Then use 2 more needles inserted 0.5 Tsun lateral from Do18 with an oblique insertion angled toward Do17. Yang-Si technique is a group of needles inserted into one specific area. It is mostly used on Do20 or on a cyst. Insert the first needle in Do20 or on the center of the cyst. Then insert the other 4 needles obliquely or perpendicularly around Do20 or the cyst. This is also used as a centralized stimulation technique and mostly used on Do20 or the Xianshan-Kong points. Insert the needle on Xianshan-Kong, which is the following 4 points: Qian-Shan-Kong, Ho-Shan-Kong, Chou-Shan-Kong, and Yo-Shan-Kong. Insert toward Do20 for a total of 4 needles, or insert 4 needles from Do20 toward the posterior, anterior, left, and right directions to the Cs and Kong points. Special square insertion. This technique is used on the Cs and Kong points. Insert the needles on anterior Sen Kong, running left to left Sen Kong. From left Sen Kong, insert running backward to posterior Sen Kong. Then from posterior Sen Kong, insert the needle forward to right Sen Kong. Finally, from right Sen Kong, insert the needle forward to anterior Sen Kong. The 4 needles, when inserted, form a square. Fan insertion. Use this technique for Lin's scalp acupuncture with 5 needles at the forehead. Insert 2 centimeters from the anterior hairline between the corners of the forehead. 5 needles are distributed in the shape of a fan with an equal distance between each needle. Needle cross insertion. This is a special technique for the stomach ache, toe point. Use 2 needles, 1 needle pointing from up to down and 1 needle from anterior to posterior to form a cross on the middle of the point. The cross needle technique uses 1 needle positioned vertically and another needle positioned in the anterior to posterior direction to form a cross on the middle of the point in order to increase the energy flow. Removing needles. It is important when removing needles to close the hole with a clean cotton ball. Because scalp points frequently bleed on needle withdrawal, it is important to check for bleeding and apply pressure for as long as necessary to ensure that bleeding has stopped. Length and frequency of treatments. The treatment course is based on the patient's individual condition, as well as how the patient tolerates the treatment. Generally, the treatment will be designed according to the disease condition, the severity of the disease, and the duration of the disease. Use a short length of time for retention for infants, patients with weakness, and patients with a psychological condition or a mild condition. For patients with severe symptoms and an acute condition, the treatment course will be a little shorter and the patient can be treated once daily. For some conditions, the needles can be retained longer and the practitioner can continue the manipulation of the needles or intermittently manipulate the needles to ensure that there is enough stimulation in a short time to improve the symptoms. Treatment length is usually 3 to 5 days for a course, extending to 7 to 10 days to maintain the effect. The treatment course will be a little longer for patients with mild symptoms, but a long history of disease. Treat every other day or 1 to 2 times per week with 10 to 12 treatments per course. For some chronic and difficult conditions, base the treatment on the patient's constitution and treat once daily for 7 to 10 days per course, or combine scalp acupuncture with macro acupuncture. The patient can be treated once a week or every other week, and the treatments should last 2 to 3 courses. Use caution because scalp acupuncture can cause strong sensations. Patients with a brain disorder or any cardiovascular condition should be needled carefully. ElectroAcupuncture therapy. ElectroAcupuncture therapy is a technique that is done by inserting the acupuncture needles in the scalp and then connecting the electro machine to stimulate the point. Use electrostimulation instead of hand stimulation to treat disease. The electro machine can perform fast rotation, stabilize the treatment, and control the stimulation. Select 2 or more points at the time of stimulation. The current level should be chosen based on the amount the patient can handle. Usually choose a small amount of current to stimulate the point for 1 to 2 minutes and once the patient becomes accustomed to the stimulation, increase the current. Treatment time for electroacupuncture therapy should be 10 to 20 minutes. Use electroacupuncture for conditions such as headache, dizziness, tinnitus, deafness, seizures, chorea, facial spasm, hysteria, stroke, or aphasia. Treat the patient once daily or every other day for 10 treatments per course with 7 to 10 days between courses. Electroacupuncture therapy should be used with caution for the following conditions. Points close to the medulla, such as Du 15, Yamen, and Du 16, Fang Fu. On the lower lateral line of the occipital area, use caution with the intensity of current used. Choose the right amount of current so that the patients feel comfortable. Take care not to increase the current suddenly or in large amounts because there is a dangerous possibility that it can cause the heartbeat or breathing to stop. Electroacupuncture is contraindicated for patients with cancer or severe heart disease. During the treatment, the practitioner should be careful not to bend or break the needles. Thank you very much for your attention. See you in our next videos.